Do you often experience heartburn or acid reflux? If so, you might be dealing with something known as GastroEsophageal Reflux Disease, or GERD for short. This condition occurs when the amount of gastric juice that refluxes into the esophagus exceeds the normal limit, causing symptoms with or without associated esophageal mucosal injury, which is a fancy way of saying inflammation or damage to the esophagus. So, you may ask, what are the symptoms of GERD? Well, they can range from typical to atypical. Typical symptoms include heartburn, regurgitation, and difficulty swallowing, also known as dysphagia. Atypical symptoms, on the other hand, can involve coughing and wheezing, hoarseness or a sore throat, otitis media, which is an infection or inflammation of the middle ear, non-cardiac chest pain, and even enamel erosion or other dental manifestations. And if you're experiencing nausea, vomiting, or regurgitation, this should be a red flag for your physician to evaluate for delayed gastric emptying. Now, how is GERD diagnosed? There are several diagnostic tests and imaging procedures that can be done. These include an upper gastrointestinal endoscopy and esophageal manometry, which are both mandatory. Ambulatory 24-hour pH monitoring is the standard criterion for establishing a diagnosis of GERD. As for imaging, upper gastrointestinal contrast-enhanced studies are the initial radiologic procedure of choice. Plain chest radiographic findings aren't particularly useful in the evaluation of GERD, but they can help assess the pulmonary status and basic anatomy. Now, let's move on to the crux of the matter, the treatment of GERD. This involves a stepwise approach with the goals to control symptoms, heal esophagitis, and prevent recurrent esophagitis or other complications. Treatment is based on lifestyle modifications and control of gastric acid secretion through medical therapy with antacids or proton pump inhibitors, or surgical treatment with corrective anti-reflux surgery. Lifestyle modifications can include losing weight if you're overweight, avoiding alcohol, chocolate, citrus juice, and tomato-based products, as well as peppermint, coffee, and possibly the onion family. It's also recommended to eat small, frequent meals rather than large meals. Wait 3 hours after a meal to lie down, refrain from ingesting food within 3 hours of bedtime, and elevate the head of the bed by 8 inches. Pharmacotherapy options include H2 receptor antagonists, proton pump inhibitors, potassium competitive acid blockers, prokinetic agents, and antacids. If all else fails, surgical options are available, including transthoracic and transabdominal fundoplications and the placement of a device to augment the lower esophageal sphincter. So, in summary, GERD is a condition that can cause a range of typical and atypical symptoms. It's diagnosed through a series of tests and imaging, and can be treated with lifestyle modifications, pharmacotherapy, and in some cases, surgery. Be sure to consult with a healthcare professional if you suspect you might have GERD.